Good afternoon, folks. This afternoon's topic is aging or injury, how to tell what's really causing your pain. Okay, then we're going to get into that and then I'll explain it to you. Give me a few minutes to set up for the show, please, and I'll be right with you. Give me 2 seconds. Okay, guys. Like I said, the title is Aging or Injury, How to Tell What's Really Causing Your Pain. Explores how to distinguish between pain caused by natural aging and pain resulting from injury. Here's a breakdown based on the surrounding page content. Okay. Key insights from video. Persistent pain as a warning signal. The video emphasizes that ongoing discomfort like nagging backache might be more than just a sign of getting older. It could be your body signaling an underlying issue that needs attention. Expert guidance. Doctors share tips on how to interpret different types of pain, helping viewers understand when it's time to seek professional medical advice. Importance of timely action. Recognizing the source of pain early can prevent further complications, especially if the pain stems from an injury rather than age-related wear and tear. Why this matters? Mis in, mis attributing uh, misattribution misattribution risk. Many people assume pain is just part of aging, which can delay necessary treatment for injuries or chronic conditions. Empowerment through knowledge. Understanding the nonsense of pain can empower individuals to advocate for their health and make informed decisions about care. Pain from injury based on pain or explore how frailty assessments might factor into this kind of diagnostic process. Here's some common signs of age related pain based on both clinical understanding and the context of the video titled Aging or Injury, How to Tell What's Really Causing Your Pain. Common signs of age-related pain. Gradual onset. Pain develops slowly over time, often without specific triggering event. Syst- uh, symmetrical discomfort. Pain tends to affect both sides of the body equally, e.g., both knees, both hips, which is typical of wear and tear conditions like osteoarthritis. Morning stiffness. Joints may feel stiff upon walking, but improve with gentle movement throughout the day. Dull aching sensation. The pain is often described as a deep aching discomfort rather than sharp or stabbing. Worsens with activity, improves with rest. Pain may intensify during physical exertion and ease when resting. Associated with uh, degenerative conditions. Conditions like osteoarthritis, spinal stenosis, or degenerative disc disease are common culprits. Predictable patterns. Pain may follow a consistent daily rhythm or worsen with weather changes due to joints sensitivity. Why it's important to recognize these signs. Misinterpreting injury related pain as age related can delay treatment or lead to complications. Controversially, understanding these patterns helps tailor interventions like physical therapy, lifestyle adjustments, or medication to support aging joints. Would you like a comparison table showing how age related pain differs from injury based pain, or perhaps a look at how frailty assessments can help clarify the source of discomfort? Age related pain arises from a complex interplay of psychological changes that occur in the body over time. Here's a detailed look at the key mechanisms behind it. Central nervous system changes, neuronal loss, and Gillosis. Aging leads to degeneration of neurons and increased glial cell activity, which can heighten pain sensitivity and reduce the brain's ability to modulate pain, reduce pain uh, inhibition. The descending pain inhibitory pathways, especially those involving indigenous uh, opioids, become less effective with age, making older adults more susceptible to chronic pain. Altered brain structure and function. Regions like the prefrontal cortex and, give me one second, hippocampus show volume loss, affecting pain perception, emotional regulation, and cognitive evaluation of pain. Peripheral nervous system changes. Nerve degeneration, loss of myelinated fibers and structural proteins slows nerve conduction, impairing signal transmission and increasing pain vulnerability. Sentinelization of neuroceptors. Aging alters neuroceptors' function, especially C fibers, leading to heightened baseline sensitivity and prolonged pain responses. Inflammatory environment. Chronic low grade inflammation. Okay. Inflaming contributors to peripheral uh, sentinelization and persistent pain. Neuroplasticity and pain modulation. Central sentinel, sentinelization. Overactive, overactivation of glial cells and disrupted neurotransmitter balance, serotonin, uh, noradrenaline can amplify pain signals and reduce adaptability. Temporal summation. Older adults may experience increased pain with repeated stimuli due to impaired modulation, a phenomenon known as wind up. Then the next section here is molecular and cellular factors. Altered ion channel function. Changes in sodium and calcium channels affect neuroceptor excitability and pain signal transmission. Cytokine release. Pro-inflammatory cytokines like IL-1B and TNF Q are elevated, contributing to both peripheral and central sentinelization. Summary table. Mechanism. Age-related impact on pain. Neuronal degeneration. Reduced pain modulation. Glial cells activation. Central sentinelization. Nerve fiber loss. Slower signal transmission. Inflaming persistent low-grade pain. Impaired opioid pathways, less effective analgesics. Altered ion channels heighten neuroceptor activity. Understanding these mechanisms is crucial for developing tailored interventions, especially in frailty-aware and memory-friendly care models. Would you like to explore how these mechanisms influence treatment strategies or how smart technologies might help mitigate age-related pain? Here's a concise summary of the key points about age-related pain based on the video Aging or Injury: How to Tell What's Really Causing Your Pain, and supporting page content. Key characteristics of age-related pain. Gradual onset, develops slowly over time without a clear injury. Dull, achy sensation, often described as stiffness or soreness, especially in joints. Morning stiffness, common but usually improves with gentle movement. Symmetrical pain typically affects both sides of the body, e.g., both knees or hips. Worsens with activity. Pain may increase during movement and ease with rest. Linked to degenerative conditions commonly associated with osteoarthritis, spinal stenosis or degenerative disc disease. Psychological mechanisms. Neuronal degeneration reduced ability to modulate pain, peripheral sensitization, heightened sensitivity due to nerve changes, Flim, inflaming, inflaming chronic low-grade inflammation contributes to persistent discomfort, impaired pain inhibition, less effective natural pain suppression pathways. Why it matters. Misattribution risk, mistaking injury based pain for aging can delay treatments. Empowerment through knowledge. Understanding pain types helps individuals seek appropriate care and advocate for them for their health. Would you like a visual infographic uh, summarizing these points or deeper dive into how frailty assessments can help differentiate pain sources in older adults? Certainly, based on the surrounding page content and recent research, here's a deeper elaboration on psychological mechanisms behind age related pain. Central nervous system mechanisms, neuronal loss, gliosis. Aging tends to degeneration of neurons and increased glial cell activity, particularly in pain processing regions like the prefrontal cortex and hippocampus. This contributes to reduced pain modulation and heightened sensitivity, impaired, de- impaired depending on inhibition. The brain's neural pain suppressing system, especially those involving indigenous opioids and serotonin, become less effective, making older adults more vulnerable to chronic pain. Central central centralization, overactivation of glial cells and disrupted neurotransmitter balance, e.g., serotonin, neuroadrenaline, amplify pain signals and reduce adaptability, leading to persistent discomfort. Okay, uh, peripheral nervous system, PNS mechanisms, nerve degeneration, loss of myelin and structural proteins slows nervous conduction and impairs signal transmission. This contributes to delayed recovery from injury and increased pain perception. Altered neuroreceptor function. C fibers and A fibers become more reactive due to chronic low-grade inflammation. Inflaming leads to peripheral sensation and hyperalgesia. Okay, ion channel dysregulation. Changes in sodium, NAV1 colon, NAV18, NAV19, accessibility, making pain signals more intense and prolonged. Temporal summation. Older adults may experience increased pain with related stimuli due to impaired modulation, a phenomenon known as wind up. Reduced adaptability. Age-related changes in neuroplasticity limit the CNS ability to recalibrate pain responses, contributing to chronic pain persistence. Molecular and immune factors. Pro-inflammatory cytokines, elevated levels promote both peripheral and central centralization, sustaining chronic pain states. Okay, guys, so let's get into some examples. Give me 1 second, please. Nerve fiber loss, slower signal transmission, delayed recovery, inflaming persistent low-grade pain, impaired opioid pathways, less effective, neural analgesia, ion channel dysregulation, heightened neuroreceptor activity, cytokine release, sustained inflammatory pain. Understanding these mechanisms is essential for developing frailty aware care models, optimizing non pharmacological interventions, and integrating smart technologies and pain monitoring and leaving a relief. Okay, guys, so that is A for you. I'll be back on with B in a little bit. For now, Gator Wellness, take care, folks. See everybody in a bit for B.